Now I'd like to invite Bernard Niemeier up to the podium.
Well, good afternoon. I'm Bernard Niemeier, President and Publisher of Virginia Business, and I would like to just take this opportunity to say hello from the magazine and thank you for having us here today. Probably be good to give a little introduction for those who may not be familiar with Virginia Business. First, a point of clarity. We are a completely separate entity from the Virginia Business Coalition on Health. Virginia Business Magazine is a 24-year-old controlled circulation business publication that goes to executives and state and local government leaders throughout the state of Virginia, reaching about 30,000 folks. As such, it really reaches the most influential people in Virginia. As a publisher, I can tell you that these are challenging times for a lot of industries. Brand building and advocacy have never been more important, and I think based on today's presentations, that may be particularly true in healthcare as the number of changes that we see coming down the pike are accelerating. I would like to, first of all, thank all of the businesses, many of the members of the Virginia Business Coalition on Health, as well as many of the medical care and providers that are part of this organization are our advertisers, and we hope that others of you who perhaps may be less familiar with the magazine will visit our booth in the atrium and find a way to get your marketing people to talk to our marketing people, because the mission of building brands and advocating for what you guys are all about really is never more important. So with that said, let me turn to the Leapfrog survey. First, I'd like to talk a little bit about the evolution of the Leapfrog survey. If we could have the next slide. It's actually began a little bit over 10 years ago with a group of large employers who put together a think tank to really sort of address the questions of what's the best way to purchase health care and how can they influence health care quality and affordability. As a business person, I think many of us know that health care is one of the most important costs facing business, and in the United States, let's face it, business is the organization that carries the load for health care cost to the large percentage of our population. In 1999, there was an Institute of Medicine report that gave the initial focus of reducing preventable medical mistakes. The last presentation couldn't have been a better setup for these awards. In 2000, the Leapfrog group was initially launched, and the initial funding came from the Business Roundtable. And in 2001, they began collecting data hospital by hospital in 6 regions. Today, Leapfrog operates in 38 regions, including Virginia. It covers over half the U.S. population. That's 51% of all hospital beds in the country, and there are almost 1,300 hospitals participating in the Leapfrog survey. Employers of all sizes use the results to be more educated and better purchasers of health care, and Leapfrog is supported not only by the Business Roundtable, but the Robert Wood Johnson Foundation, Leapfrog members, and others. Now, when it comes to Virginia, the Virginia Business Coalition on Health is a coalition of employers and other stakeholders that has began the regional rollout of Leapfrog in Virginia in 2003. We now have 89 hospitals who have been invited to participate. 34 of those, or about 40%, are participating, and this includes about 50% of the urban hospitals in Virginia and about 16% of the rural hospitals. As the phrase is often used at these meetings, much of what we're talking about here, all of what we're talking about here, is evidence-based. The Virginia Business Coalition on Health supports a body of research that shows that measurement and public reporting can indeed improve quality. The way this works, report cards are presented during educational programs, and the Leapfrog site is posted to each Virginia Business Coalition Health website, and employers design benefits around Leapfrog transparency and organizations fully meeting the LEAPs. There are hundreds of Leapfrog thank you flyers are distributed on an annual basis. And we certainly appreciate the participants of the Leapfrog program. The next slide will show you, I think we're a couple slides behind here, Paz. Maybe I need to say next one more time. One more time. Once. One more. That's it. Okay. This is, for example, is an ad that the coalition put in Virginia Business Magazine thanking the Leapfrog participants. Next slide. So with no further ado, let's move on to recognizing the progress that's been made here in Virginia. And if you would, great, thanks. If you would hold your applause until after the categories are announced. In the first category, we have computer physician order entry. And this leap was fully met by the VCU health system. They met 4 of all 4 criteria for that. And at the same time, there's hope for 2009 and beyond, next year's survey, in that these organizations met 3 of the 4 leaps in this category: the CJW Medical Center, Lewis Gale Medical Center, Riverside Regional Medical Center. So let's give all these folks a round of applause. Our next category is these are about the same order. Is evidence-based hospital referral, which essentially comes down to a high success rate, appropriate care, and low cost. And this leap was fully met by Bon Secours Maryview, CJW Medical Center, Enrico Doctors Hospital, Riverside Regional Medical Center, Centera Careplex Hospital, the VCU Health System, and the Winchester Medical System. Let's give them a great round of applause. The next category is appropriate ICU staffing, and this leap was fully met again by Bon Secours Maryview, Children's Hospital of the King's Daughter, Riverside Regional Medical Center, Centera Careplex Hospital, Centera Lee Hospital, Centera Virginia Beach Hospital, and Centera Williamsburg Regional Medical Center. Let's give them a round of applause. Our next category is steps to reduce harm as measured by the Safe Practices Score, and this was fully met by the John Randolph Medical Center, the Lewis Gale Medical Center, Pulaski Community Hospital, Retreat Hospital, Centera Lee Hospital, Centera Norfolk Hospital, General Hospital, Centera Virginia Beach General Hospital, and Centera Williamsburg. It's notable that Retreat Hospital had the highest point total in all of Virginia on this. Let's give them a round of applause. Next is managing serious events, which is essentially adherence to the never events policies. And these were fully met by Allegheny Regional Hospital, CJW Medical Center Chippenham Campus, CJW Medical Center Johnston Willis Campus, Culpeper Memorial Hospital, Fauquier Hospital, John Randolph Medical Center, the Lewis Gale Medical Center, Montgomery Regional Hospital, Pulaski Community Hospital, Retreat Hospital, Reston Hospital Center, Riverside Walter Reed Hospital, Rappahannock General Hospital, Enrico Doctors Hospital, and Enrico Doctors Hospital Durham Campus. Again, let's give them a round of applause. And at this point, we turn to our special recognition awards. Hospitals that fully met 2 leaps. First, we have Centera Virginia Beach General Hospital and Centera Lee Hospital. Dr. Jean Burke, would you please come forward and receive your recognition? Next is a recognition of the VCU health system. They fully met their CPOE LEAP, and they fully met the most high-risk surgical procedures, which covers 5 procedures. So Dale Harvey, would you please come forward and receive your award? And finally, we have our Special Recognition Award for the rural hospital as the most fully transparent, and this goes to Allegheny Regional Hospital. And Latstetter, would you please come forward? Just to give you a little rundown on the process for the 2009 awards, the letters and security code packets were mailed on April 2nd by the regional rollout leader, which is again the Virginia Business Coalition on Health. The complete survey runs through June 30th of this year. Results will go live at www.leapfroggroup.org. And the hospitals will update the results monthly through March of 2010. The goal for next year is to, of course, have more hospitals complete the survey. The Safe Practices LEAP is very important, as is the adherence to never advance policies. And you know, being in the media business, we also talk a lot about transparency and let people understand how we do what we do in journalism, and I think obviously that applies to many areas of business and healthcare as well. And this is a pretty good list of benefits of transparency. First of all, people recognize how you do what you do. There is a financial reward when you build trust with people. The summary performance report helps with transparency, and there are other reports on hospitals' quality improvement, and this ultimately results in more patients being steered to your hospitals. Your employers and employees appreciate this, and if you need any more details, please contact the website or the Virginia Business Coalition on Health. After this segment of the program is over, if the recipients could please gather out by the registration table for a photo. We don't want to interrupt the next session. That'd be great. So again, congratulations to everyone. Thanks for having Virginia Business here. We enjoy working with you.